Good day. I'm Professor Farnsworth, and this is Blood-Borne Pathogens in Schools, the Fundamentals, which, for the sake of brevity, we'll call BBPs.
You know, back when I was a boy, my great-grandmother would tell stories of the times when she taught in a one-room schoolhouse. Ah, those were the days. Starting a fire in the old potbelly stove, toting water for drinking and washing hands.
Back then, they didn't know about BBPs. Now we know more, about the diseases anyway, and steps you can take to protect yourself when facing possible exposure to blood-borne pathogens. Here we have a representative BBP. My point precisely. You can't see them. They're invisible. They live in the blood and body fluids of infected people. Virtually anyone could unknowingly be harboring a potentially deadly BBP. Most disturbing.
Many people who are infected with BBPs have no symptoms and don't look or feel sick, in some cases for up to 30 years. However, all along the infection is slowly damaging their liver, and they're contagious. The three most common BBPs are hepatitis B, called HBV, hepatitis C, called HCV, and human immunodeficiency virus, or HIV. Most people think of HIV when they hear the word blood-borne pathogens, but actually, the hepatitis B virus is 50 to 100 times more infectious than HIV and more easily spread in the workplace. The hepatitis B vaccine can prevent HBV, but there's no vaccine to prevent HCV. Both hepatitis B and C are viruses that attack the liver. Once infected, you could have a mild infection that goes away in a short time, or you could have a chronic infection that lasts a lifetime and could lead to liver disease, liver cancer, even death. Only blood tests can positively identify these diseases. If you do have symptoms, they're mild and flu-like: nausea, fatigue, loss of appetite, fever, headaches, and abdominal pain. Or you can have jaundice and abdominal pain. Human immunodeficiency virus, or HIV, the virus that causes AIDS, attacks a person's immune system. Like hepatitis, people with HIV can live normal, seemingly healthy lives for years without knowing they're infected, and still be contagious. But when the immune system breaks down, they develop AIDS. There's no vaccine for AIDS and no cure.
Yes, where were we? Let me see. How are these BBPs transmitted? That is to say, spread from person to person. That is to say, how does one become exposed or infected in the first place? Which is, of course, what we're trying to avoid here.
The most common ways BBPs are transmitted are through unprotected sex with an infected person or by sharing needles or other paraphernalia to inject drugs. Infected mothers can also pass a virus to their newborn children. In a school environment, BBPs are more likely to spread when you touch something like a countertop contaminated with blood or body fluids, and then touch the mucous membranes of your eyes, nose, or mouth. Contaminated surfaces, like desk or athletic equipment, are a major factor in the spread of BBPs because the hepatitis virus can survive outside the body. HBV can survive on surfaces and equipment for at least a week. The hepatitis C virus can survive outside the body on environmental surfaces for at least 16 hours, but no longer than 4 days. During that time, the virus can still cause infection if it enters your bloodstream. BBPs can also spread when you injure yourself on a needle or sharp object that's contaminated with blood or body fluids, anything that can pierce your skin. Or if you touch a contaminated object, pathogens can enter your bloodstream through an opening in your skin. Cuts, razor nicks, dermatitis, acne, or even openings you can't see. According to the Centers for Disease Control and Prevention, it may even be possible to become infected when poor infection control practices are used during tattooing or body piercing, or from sharing razors or toothbrushes.
Now, for school employees like us, the risk of actually getting one of these BBPs is minimal compared to, say, doctors or nurses or other workers exposed to blood and body fluids all day long. EMTs, lab technicians. However, if you take the number of those infected
An estimated 800,000 to 1.4 million people in the U.S. have chronic hepatitis B. 3.2 million people have chronic hepatitis C, and somewhere around 1.3 million people are infected with HIV.
Then you calculate that as a percentage of the total population, and then you apply that ratio to the total number of school employees in the U.S., taking into account the increasing number of cases each year. Then your odds of getting infected are 0.000171188 times, no, it's 1.73 times 10 to the negative third. Let's see, applying the quadratic equation, remembering to carry the 1.
Guidelines have been developed by the Centers for Disease Control and Prevention, the CDC, and the Occupational Safety and Health Administration, OSHA, to protect you from exposure to bloodborne pathogens. You'll find some of that information in your school's Exposure Control Manual, along with a list of hazards you'll face on the job, how to reduce your risk, and what to do if you're exposed.
Standard precautions, a term we get from our friends in the medical community, since BBPs are, after all, medical conditions. Well, at least the viruses are.
Standard precautions mean you assume that everyone is contaminated with HIV or hepatitis, and you don't take chances. A simple playground incident, a bloody nose, or an athletic injury, each one has potential for exposure to BBPs. Protect yourself with personal protective equipment, or PPE, including gloves, as well as mask and protective eyewear if necessary. Your employer will provide you with PPE and train you on how to use it, but it's your job to make sure it's kept in good working condition so you can use it at a moment's notice. Damaged or loose-fitting PPE does not protect you. When an incident happens and a person begins to bleed, your first reaction, as a person of authority, is to help the injured person. But how do you know if the victim is infected with hepatitis or HIV? You don't. He may not know. Without protection from blood or body fluids, your natural inclination could cost you your life, or at least your health, and potentially the health of your loved ones. When assisting someone who is injured or bleeding, follow these precautions. If it's serious, send someone to call for emergency personnel. If the individual has a minor cut, they should try and stop the bleeding themselves. If they need help, apply pressure to the wound, but protect yourself first. Put on your PPE. Remember, cuts, sores, or breaks on your exposed skin should be bandaged, since gloves may leak if torn or punctured. If no gloves are available, place a barrier between you and the blood or body fluids, but it's always best to keep gloves handy and inspect them routinely so you're prepared for emergencies. Remove the gloves as carefully as possible. Never touch the outside of the glove with bare skin. Peel one glove off from the top of the wrist to the fingertips and hold it in the gloved hand. With the exposed hand, peel the second glove from the inside, tucking the first glove inside the second. Then, dispose of your gloves according to your school's exposure control plan and wash your hands with soap and water.
The one-room schoolhouses in Grants Day had no running water. The bathroom facilities were outside. And the students and the teacher had to wash their hands in an old bucket like this. Today, it'll take more than a quick dip in the old bucket.
CDC guidelines recommend washing your hands when they are visibly soiled or contaminated, before eating, drinking, handling contact lenses or applying makeup, after using the restroom, and after blowing your nose, coughing, or sneezing. Begin by wetting the entire surface of your hands and wrist. Using a non-abrasive soap, rub your hands together for at least 20 seconds. Be sure to wash between your fingers, around fingernails, and under rings. Now keep your hands pointed downward as you rinse to keep the contaminants off your hands, and dry with disposable towels. One more thing, use a towel to turn off the faucet, not your hands. Then dispose of the towels immediately. You wouldn't want to leave a contaminated towel for someone else to use. If a hand washing facility is not available, use antiseptic towelettes or an alcohol-based sanitizer until you can get to one. Apply the recommended amount of the product to the palm of one hand and rub your hands together, covering all surfaces of your hands and fingers until your hands are dry. But wash with soap and water as soon as you can. If blood splashes or gets in your eyes or nose, flush your eyes and exposed membranes with large amounts of water. Then report the incident to your employer or supervisor immediately. Do not wait until the end of your shift. Most exposures do not result in infection, but time is of the essence with these kind of exposures. If you get appropriate treatment quickly, you can prevent infection. Don't attempt to clean up blood or other body fluids unless you're trained or authorized to do so. Notify the custodian or an employee especially trained in cleaning up spills. If you have to pick up potentially contaminated sharp objects, such as needles, knives, razor blades, or broken glass, never use your hands. Use tongs or a broom and dustpan, then dispose in a facility-approved puncture-proof container. If any articles become contaminated with blood or body fluids, follow your school's policy for decontaminating or disposing of them. If you empty garbage cans, shake them down and always carry them from the top, never close to your body, in case someone disposed of a sharp object that can cut through the bag and cut you. Keep your work area clean to reduce your potential for exposure. Minimize splashing, spraying, spattering, and generation of droplets when attending to an injured student or coworker, especially where blood is present. Don't eat, drink, smoke, apply cosmetics or lip balm, or handle contact lenses where there's a likelihood of exposure. Don't keep food and drink in refrigerators, freezers, or cabinets or on shelves, countertops, or bench tops where blood or other potentially infectious materials are present. Wash your hands routinely throughout the day, and don't be shy about reminding your students to do the same. And keep your hands away from your eyes, nose, and mouth. Roll up your sleeve for the HBV vaccination. It may be one of the best ways to prevent HBV. If you're exposed to blood or other infectious materials as part of your job, the school system may make the HBV vaccination available to you.
Ah, yes. Where were we? You've learned about the dangers of BBPs and how they spread, that is to say, how one is infected, and you know the proper precautions to protect yourself.
Standard precautions essentially means you decide that everyone is infected and take action to protect yourself. You wear PPE when you anticipate contact with blood and body fluids. You keep your environment clean and your hands washed.
Now, mind you, most people exposed to BBPs never become infected, but the fundamental reality is this. If you take these precautions, against disease that is, the odds of your becoming infected are significantly reduced to, well, as Gran used to say, you can never be too careful. Professor Farnsworth here. Good day.